Okay, so would you introduce yourself, please?
Yes, I'm Dr. Jeff Morgan, and I'm with Omega OBGYN, and we have offices in Mansfield, Arlington, and Grand Prairie.
And I know that January is Cervical Cancer Awareness Month. Can you tell us what age someone should start screening for that?
The current recommendation is age 21. That's the time when someone should begin to get a Pap Smear and a gynecologic exam.
And then how often does someone need to be screened for that?
Initially, the recommendation is every year, and then over time it may change as determined by you and your physician. After a series of several normal Pap smears, the Pap smears may be actually spaced out.
And the Gardasil injection, is that something that's effective in preventing, and can you prevent cervical cancer?
The Gardasil injection was designed to cover the most common HPV viruses that could lead to cervical cancer.
Okay.
It does not cover all of the different varieties out there. It does cover some of the high risk, so those that receive the immunization will be at less risk, but it does not totally exempt or cover you from any risk of cervical cancer. So there's still an importance that you get a regular exam and screening.
Is that something that everybody gets, or is that injection? When does that occur?
The ideal time is between age 9 and 13. It can be given 9 to 21,
Okay.
but if it's given before they become sexually active, it's more effective because they've had no exposure to any kind of HPV virus.
Are there any risk factors for developing cervical cancer?
Yes, there are risk factors. Genetics seem to play an important role.
Mm-hmm.
Smoking is another risk factor. Of course, having multiple partners is another risk factor for cervical cancer.
What's the treatment for cervical cancer if you do get it?
If you get to the point that you actually get cervical cancer, initially it will depend on the stage, but usually will include a hysterectomy, may include chemotherapy as well as radiation treatments.
Anything else that you would want to add?
Sure, I think the key to preventing cervical cancer is to get regular checkups and regular screenings. With Pap smears, we can detect the changes early, and we can treat them by simple procedures in the office without them ever getting to the stage that they're cancer. And the good thing about cervical cancer is its progression is very slow.
Okay.
So to go from a pre-cancer to a cancer, it's usually you're looking at years. So as long as you're coming in regularly, it can be caught and treated.
How would we get a hold of you?
You can contact our office. Our main number is 817-468-3255.
Okay. All right, great. Thank you very much. Appreciate it.
Thank you.